Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Why might GLP-1 drugs reduce alcohol cravings? New experiment suggests an answer. Breaker number 148. Weight loss drugs like Ozempic and Zepbound appear to reduce alcohol cravings, but doctors have been at a loss to explain why. And number 147. Until now. Break glucagon-like peptide 1, GLP-1, drugs appear to slow the speed at which alcohol enters the bloodstream, which also diminishes its effects on a person's brain, according to pilot study results published October 15 in the journal Scientific Reports. Essentially, people don't feel the effects of alcohol as intensely if they're taking a GLP-1 med, researchers said. And number 156, people who drink no There's a difference between nursing a glass of wine and downing a shot of whiskey, and number 157, researcher Alex DeFelicentonio said in a news release. She's interim co-director of the Roanoke, Virginia-based Fralin Biomedical Research Institute at VTC's Center for Health Behaviors Research. Both drinks contain the same amount of alcohol, but the shot brings a rapid increase in blood alcohol content and, subsequently, intoxication, DeFelicentonio said. And number 156, why would this matter? Faster-acting drugs have a higher abuse potential, and number 157, she said. And number 156, they have a different impact on the brain. So if GLP-1s slow alcohol entering the bloodstream, they could reduce the effects of alcohol and help people drink less. And number 157. GLP-1 drugs mimic the GLP-1 hormone, which helps control insulin and blood sugar levels, decreases appetite and slows digestion of food. For the new study, researchers recruited 20 people with obesity, half of whom were taking a GLP-1 drug. All had a body mass index, BMI, of 30 or more. BMI is an estimate of body fat based on height and weight. The participants were served an alcoholic beverage that had to be consumed within 10 minutes. Researchers measured their breath alcohol and asked them questions about how they felt, such as and number 156, how drunk do you feel right now? And number 157, on a scale from 1 to 10. This process was repeated 3 times over an hour. Researchers saw less than speak greater than ID. In the end, people taking GLP-1 drugs consistently reported feeling less intoxicated, the study found. Data taken during the experiment indicated that GLP-1 drugs' ability to slow stomach emptying likely reduces the effect of alcohol, researchers said. Other drugs designed to help reduce alcohol intake act upon the nervous system, researchers noted. For example, acamprosate stabilizes neurotransmitter activity in the brain, offsetting the effects of alcohol. And number 156, our preliminary data suggest that GLP-1s suppress intake through a different mechanism, and number 157, DeFelicentonio said. Researchers said this could open up another means of helping people battle alcoholism, but larger clinical trials are needed to confirm this. Sources: Fralin Biomedical Research Institute at VTC, news release, October 15, 2025. Disclaimer: statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek personalized medical advice for individual healthcare decisions. And copy, 2025 Health Day. All rights reserved. Ad as a preferred source on Google. Read this next smart patch helps addicts, alcoholics manage stress and cravings. Friday, October 3, 2025 and number 148, A and number 156, Stress Coach and number 157, Smart Patch can help people struggling with addiction or alcoholism manage their anxiety and cravings, lowering their HHS withdraws report linking alcohol to higher cancer risks. Monday, September 8, 2025 and number 148, Federal health officials have withdrawn a government report warning that even small amounts of alcohol could raise the risk of cancer and other. Break diet, exercise, protect liver health from alcohol damage, study says. Break Thursday, August 28, 2025 and number 148, enjoy a pint of beer, a glass of wine or a dram of whiskey. Then make sure you have some healthy eats and a good dose of exercise on the side. Break more news resources to MedWatch Drug Alerts Daily Med News for health professionals, new drug approvals, new drug applications, drug shortages, clinical trial results, generic drug approvals. Subscribe to our newsletter. Break whatever your topic of interest. Subscribe to our newsletters to get the best of drugs.com in your inbox. RX Guard Club, do less than /speak. Speak greater than TCOM. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.